Welcome to the HBOT News Network, and it's an honor to continue the conversation with Commander James Stewart Hooker. And Commander Hooker is going to continue the conversation about the suicide crisis, clearly, that's gone on in our country. And so, welcome back, Commander Hooker.
Thank you. Good to be with you again.
So one of the things that at least I'm witnessing today is people are becoming more aware of alternative medicines, and especially after we did the series with Dr. Harch, that even the concern for the medical industrial complex machinery needs to move forward towards more functional approach to medicine. And that's clearly what this is. It's a very functional thing. As you and I both know, hyperbaric oxygen has been around since the second day. Okay, it is not new. I think there's a common thought for doctors that there's no money in it. Well, I think that there's a fair living in it if you approach it the right way, and that's what we're trying to do, is educate doctors and say, okay, this is a component of therapy for your practice, and look at all the benefits you can bring your patients, and maybe the majority of the medical industrial machinery will be working to help heal people that are 100 years old, and we get the population and lifespan to increase. And so how do we do that? How do we get people there using, functional approaches? And it's integrative medicine that I think is the way, right? Because when it comes to antibiotics and certain, surgical procedures, things like that, they're invaluable, right? So there's not a battle going on here that I can see that's really valid, So sort of circle back to that question that I asked earlier, and I'm just curious how you feel. You go into these meetings now for 10 years and you hit the brick wall. Either they don't act on it or they fight you on it right there in the meeting, and it's this lack of education. But when you go into those meetings, Jim, we have this book. You give them all the education that they could potentially, ever need. Of course, there's links. All you have to do is search hyperbaric oxygen and put any indication in there, and you're going to find a single person study and testimony, you're going to find a clinical trial, you're going to find an article, you're going to find something of substance that there may be some bias, but it may also be peer reviewed and no bias. So the information's out there. So when you leave that meeting, to me, you're the person that should be the most frustrated, because I see you making the calls, you're fighting the fight, but you get up every morning, Jim, and you just keep going. So how do you do that?
Well, it's actually easy on two counts. The first one is that as you do, I have a complete understanding of why it is that the people in leadership in the Department of Defense and in the Veterans Administration are not using oxygen therapy for TBI and PTSD. And the reason they're not using it is not because what they are using is working, which we know is not the case. It's because the drug industry has control of the entire medical community on the brain. In effect, that's really what's going on. So what does that mean? Well, it means this. As I said earlier, there are 40 some odd symptoms of a TBI and PTSD, and for every one of those symptoms, there's a drug or more than one drug, multiple drugs. Pain, for example, there's all kinds of drugs for pain. Sleep disorder is another one. There's all kinds of drugs for sleep disorder, just to mention two. So it turns out in I want to say 2018, you might want to, I guess I don't want to get held to this number, but this is the idea. There was something on the order of $20 billion in military medicine in 2018, just military medicine. The other thing that we know about that and the drug industry is that we're not just talking about TBI and PTSD. We now know that oxygen therapy has an effect on a number of other brain-centered illnesses, multiple sclerosis,
Well, one of the points you brought up earlier was, was the medications that are being prescribed could also be adding to the suicide crisis. And I think opioids clearly, and overdosing, and now, you hear about fentanyl, being interjected or laced or however else it's being given. But the symptoms or the side effects, I think is probably the best way to describe that. The listed side effects can be suicidal ideation for some of the medications that they're taking. And so preventing, suicide, that to me is what got me into this. Coming back from Albuquerque and seeing that number, 22 a day, soldier suicide, and then really learning more, even through some of the Red Cross activities I was involved in. And this goes back 100 years. This goes back many wars. It likely goes back from the initial first war ever, where someone got hit in the head. Okay, I mean it's been around, and people have been getting hit in the head, from the beginning of time, I'm sure. So this has been around a long time. It's nothing new. Okay, suicide has come to the forefront, and that has always been, to me, that has always been your first statement is don't forget the soldier suicide. Don't forget the suicide, and I think that's one of the key things that motivated me and you as well.
So we have the White House now, and 5 of the largest U.S. departments concerned with health: the National Institute of Health, CDC, and the Service Generals, Navy and Army. Have all put out, and the VA, Veterans Administration, have all put out suicide prevention plans. And those suicide prevention plans have basically looked the same for about 10 years. So they haven't changed the plans at all.
And really no results, no positive.
That's the whole point is there's been no effect on suicide prevention.
Yeah.
The suicide prevention plan they have and the strategies they're using are not preventing suicide. Mm-hmm. On the other hand, we now have science and personal testimony. I want to talk about personal testimony in a minute, but we now have science that says if you are a person with a head injury, a veteran or whoever he might be, and you have an indication, an ideation for suicide, you're thinking about killing yourself, oxygen therapy, because it heals the symptoms, or maybe at the very best, or at the very worst, it mitigates them to the point where you're no longer thinking about killing yourself, works to prevent suicide.
Mm-hmm.
And we know it does that now.
And possibly take it a step further, it's not masking the symptoms either. It's actually what's causing the symptoms that it's fixing. So you have this permanent effect, and then the question becomes is how much do you need? When should you get it? All of these things. So it's been that battle, and suicide, has been your focus, and I, at least that's what I hear from you whenever we interact, is that you said don't forget suicide.
Yeah, and the reason I say that is because it is the Achilles heel of the entire therapy approach, the whole protocol approach for the services in VA. Mm-hmm. They don't have an answer for suicide. Their suicide prevention programs are the same they've been for 10 years. It's not working, and everybody knows it. There isn't anybody in the country that doesn't understand it. The Congress understands it. When I talk to legislators, they understand it. What they don't understand, and the reason we need to work on getting them understanding it, is that oxygen therapy is doing what you just described. It's taking those symptoms and either removing them or mitigating them enough so they're ready to go have a life again. Mm-hmm. And they're not thinking about taking their own lives anymore.
Yeah, it's healing what's causing those symptoms. And so you just look at suicide in the U.S. overall, I think that number is pushing 100,000 a year. And that's reported. That's the CDC statistic.
I just read the CDC just reported it's the 8th leading cause of death in the country now, suicide.
Yeah. So here's this therapy, and it's sort of like this breakthrough that's been there for over 100 years. And we're sitting here talking about how people don't know about it, So what did it take for them to suppress the general population from knowing that, that there was this therapy that is as simple as pressure and oxygen that pushes the oxygen into your blood plasma, that stops the inflammatory response throughout the body, primarily the only thing that stop that inflammation in the brain. And so there's this thing. So how is it even possible, Jim? I mean, there must be points where you're extremely frustrated, at this total ignorance.
Yeah. So the second part of the answer you asked earlier, the question you asked earlier is, what motivates you? What motivates me is the Ben Richards story. You see these people get this therapy, and they get their life back. They don't just get well; they get a chance to go do exactly what they were capable of doing all along.
And now
he's a teaching professor out of the university. This is where the guy was going to go.
Well, and in the state, North Carolina, the legislation took a couple of years to get funding, led to some funding, and now the state is paying for treating the soldiers in the state, and so there's a number of cases I think that you could point to, like the Ben Richards case, where people's lives have returned. Perhaps you could share some of that with us.
I can. So we had. Going back about half a dozen years, we wound up with a connection with the Wounded Warrior Battalion at Camp Lejeune. And the short version of that story is we had doctors from the emergency room practice at the hospital at Vidant Hospital in Greenville and the rehabilitation medicine practice agreed to go with me and some other folks, and we went down to visit the NICO down there. The NICO is a National Intrepid Center of Excellence. It specializes in treating men and women with TBI and PTSD, does not use oxygen therapy. And we had quite a dialogue with the Navy captain who ran that operation at the time. What came out of that was not that he changed what he was doing, but the word got out from some people down there, in particular the case nurse practitioner, case managers, who are managing these men and women going through Wounded Warrior Battalion, all these damaged men and women, that oxygen therapy was a possibility for somebody with TBI and PTSD. And the very first veteran that we treated was a sergeant major who had successful therapy, and he had the same story Ben Richards had. He got his life back. He got his wife back, who was not living with him any longer. He got his family back. He started a business, and all that's happened as a result of his oxygen therapy. Mm-hmm. So watching and understanding that it works, that's just a huge motivator for me.
Yeah.
I don't need much more than that. When I see a family come home, all the way home, that was our mission back in Washington years ago.
So now the state has funded a program, and so how many veterans will the state fund?
So we've had 22 veterans that were treated from the funding that we received in 2021. We've received additional funds in 2022, and we now have 8 veterans that have been approved for that. 6 are in therapy now. Mm-hmm. So of the 22 that were originally in the original program, about 20 of them are finished. There's 2 at the tail end of that. Of the 6 that were in therapy in the 20 program, 1 I think is now done, and the other 5 are continue to be in therapy, and we've got 2 more that we're working on getting in.
Yeah, so we did have the opportunity of interviewing Ernie Harrison, Donnie Harrison.
William Harrison.
Ernie Harrison.
Oh, Ernie Harrison. Oh, I'm sorry, yeah.
Yeah, I think he's related to the sheriff or something. Anyhow, Ernie's family is a long time in North Carolina, and we interviewed him here, and he. I ran into him after that. I think he's just finishing the 40. He did maybe very recently. Could have been as recent as yesterday. I spoke to him. He was almost done, and
his name is William Harris. He goes by Ernie. That's him.
Ernie.
That's
him.
Yeah.
So he was telling me that he shared with me that he went to the state fair, and he brought his children with his wife and his 6-year-old, And he said, so, since his military service, and he clearly was a warfighter he had some serious head injuries, that it was the first time he was able to be in a crowd with his 6-year-old. And so what a change for him to be able to be around people. And of course, that's the therapy that he's done. He's just finished 40 treatments, I believe, and he's seen a huge change in his just ability to cope with lots of things coming at him. And I think executive function is probably a key there, being able to decide if it's a dangerous situation or it's not, to be able to be more relaxed around a large crowd of people. So I think that's clearly, for me, there's a lot of gratification, like you just mentioned, when you see an individual that's been a war fighter, been a hero, sacrificed for our freedoms, come back and have this terrible disability, and then that you can make a difference, and you can help them. And there's nothing better than feeling that you're making a difference. And I know you've had a number of those situations.
Oh yeah, it's one life at a time.
Yeah.
And more importantly, it's one family at a time. And as we know, the most fundamental problem we have in our society today in this country is the family. It's really about the family functioning as a family, functioning as a unit. And God made us men and women for a reason. And you need a man and woman to have a family, to propagate children, to raise them properly. And if you have one partner that's not there because they're not functioning properly, that destroys the family.
Yeah, I'm sure you've gotten some hugs from family members that thank you for saving their loved one with the therapy.
Yeah, Ed, this as well as I do. It's just a privilege to be able to see that happen to somebody, to have been any part of it. Mm-hmm. Now we have a team of people who are working on this. We have a clinic called Extra Vita in Durham that is treating these veterans. Mm-hmm. We have I mentioned Mike Weeks, a former general manager at WITN News, that helped us put together a complete advertising and media campaign so we could actually get the word out to veterans that it was available to get. We have had the state of North Carolina legislature, key people in that legislature, Tim Moore, who's the head of the House, and Don Davis, who is a senator who has helped us sponsor the funding.
And that money is funneling through a nonprofit.
Funneling through a nonprofit called Community Foundation of North Carolina East, mm-hmm. located in Greenville. Melissa Spain has the same fire in her belly that I have for this, for the same reasons that we just described. She's mm-hmm. seen that very same thing happen I have seen happen, and once you see that, it just changes you forever.
Yeah.
Now I have the privilege of being old enough so I don't need to work anymore, and I can really dedicate myself to this. And it's interesting you had mentioned that I would be finding these people to talk to who are at the top all the time. It's not easy to find those people, as you and I know. Mm-hmm. And it's also difficult when you go in and talk to them, as we did, for example, in the Durham VA, where we went in and talked to the head of the neurology department there, and get a reaction out of them that was very, I'm probably saying very negative is unfair to them. I guess what it really was very, very much obtuse. It was like, well, we hear you, but we're really not interested. It was more like that than anything else,
Mm-hmm. Well, one of the things I think that people are becoming more sensitive to, because it's been thrown out there in the media, especially with this whole COVID, crisis. And no matter which side you were on, the pandemic or plandemic, it was a crisis for the nation, no doubt about it. And then the vaccine, because we're seeing the COVID injuries, we're seeing the vaccine injuries, and HBOT and its application to it. We talked a bit about that when Dr. Harch was here in one of our segments. And so one of the things you keep hearing, though, is that people become more sensitive to the science. What is the science? follow the science. Some claim to follow the science, but they're ignoring the debate. And so one of the things I think that's important moving forward is to find individuals that are decision makers that are willing to not just understand the science, but enter into the debate, because there needs to be an answer why we're not doing this. Because we know it works, we see it work, it's saving lives. These suicides are occurring across the nation. If you look at the nearly 100,000 suicides that are occurring in our country each year, and do the simple math, okay, it's 3,000 a day, or close to that. That's a lot, right? 100,000, right? 3,000 a day. It's very, very sad. Maybe it's 2,800. and so why are we ignoring it? Why do we keep kicking the can down the road? Why are we ignoring the science? And so that's our battle, isn't it, Jim?
It is, and it turns out that there's another part of that battle that has to do with what science is and what is not accepted as science. And I like to go down this path because I find it really interesting to me. I spent a good bit of time in my earlier career in courts and came to understand how they function. And it turns out when you go into a courtroom, if you're an attorney, the best piece of evidence you can present is from a witness. So if you have a witness that actually saw something happen or was a participant in that event and could witness some part of the event, that's like the gold standard for a courtroom. On the other hand, when you talk about health, or you talk about TBI and PTSD and oxygen therapy, and you have these people that you've heard us describe who stand up and say, I got my life back, and they use, those kind of words. That's really what they say. When they say that, that's about the most powerful, to me, it's the most powerful thing. I can read science all I want, and I've read a lot of it. And it talks about a symptom and a standard to measure the symptom improvement from this bar to that bar and all that. And those are all, and it's not that it's not meaningful. It's not that the scientific standard and the way we measure it and how we figure it out is not important. But what's more important, what's most important, is we actually have a patient that got his life back, that was in a place where they were going to kill themselves, and they got their life back. We have those people who are able and capable and do come forward and say those very things.
Yeah, so a lot of that can be hidden behind the conflict of interest concern, or it's anecdotal. And I think that's the word that people would say in the science community, in the medical community, and it's really a deflection, isn't it? Because if in a court of law, the proof is in the patient, really. And so if we're focused on the patient, one of the things that that I've heard said is that how many hyperbaric treatments should I do? I think the simple answer there is do it until it doesn't help you anymore. Okay, so if you see the significant gain, keep doing it, and if it stops helping, and you've probably had enough, and things like that. So I think it's a great point, Jim, and I think that experience in the courtroom, that's invaluable when you apply it to the challenges of what we're dealing with, but it's got to be frustrating too at the same point, because what works in the courtroom is not working in this community that refuses to debate, okay, the patient experience and identify why they won't try it, why they don't use it, why it's snake oil. I've heard that term. They avoid it, and it's a very unfortunate thing, isn't it?
So the example that I would use of that idea about somebody's testimony was an experience you and I had when we were recently in the speaker's office with his staff, and we were talking to him about getting funding for the 2022 program. And you will recall this like I do. It turns out that we showed a video of an Army chaplain who had been deployed in Afghanistan, out near Pakistan's border, who had suffered a TBI, who had received 40 sessions of HBOT, and said, "I got my life back." And not only that, I was thinking about suicide. And he did all that in 3 minutes. It turns out it's a pretty powerful video. But we put that in front of the staff for Speaker Tim Moore, and that kind of closed the deal to me. I mean, I watched that guy's face, and it was, when he saw that, it was over. I mean, it was really over.
And that was the second year of funding.
That was the second year of funding.
So those individual testimonies, I think, are important, and the industry needs to continue to collect them. And we'll get some of the the soldiers that have gone through the therapy in here to interview them, so they could share their experience. And I know there's an effort to continue to interview them outside of the network for the individual clinics,
Yep.
and to continue to promote it. So the battle goes on. Is there something that you, I know, we're limited on time, your time is valuable. Is there something specifically that you wanted to talk about that we have missed?
Well, I'd like to spend a little more time on talking about the subject of suicide. So, as you know, I lost a son to suicide. And it turns out that coming to grips with losing a child, anyhow you lose them, is really a very difficult process for your heart and your mind. But especially coming to grips with somebody who's taken their own life, that's really a desperate measure by any means or any measure. And to really to get to the place where you can understand how your own child would do that, that's a very difficult journey to travel. So, and it turns out, again, the Lord's been blessing me in this regard, because He's taken me to a place where I really understand now how these men and women who have all these incredible symptoms, and the amplification of those symptoms from the drugs they take to try to get rid of them, multiplying the effect of that symptom in effect really for suicide and suicide ideation. And where that takes them is a place that I would describe as absolute, complete hopelessness. So my son got to that place, and he got to that place without us knowing it. And it wasn't like we weren't watching him and understanding that he was not right, because we knew that all along. We knew he was not right. He was heavily overweight. His life, his employment, everything about his life had been difficult for a couple of years. And it turns out he had multiple myeloma. So he also had a serious disease. And he had stem cell therapy for his multiple myeloma. Then went back a couple of years. And when he had that therapy, they told him then that, you might get a couple of years from this, and probably not too much more than that. So we all knew that he had a terminal illness. But he was a very private guy. He's also a very, very bright guy. Not unlike a lot of these military families, these men and women have had brain injuries. Anyhow, he got to a place where he decided that his disease had overtaken his life, and he just couldn't function anymore. And he didn't share that with us. I have to tell you that that the thing that I've learned about suicide with these military men and women who are taking their lives is that is exactly where they go. So when you read suicide prevention strategies that are designed to say, call a hotline and we'll talk to you, and we're going to interact with your family, or we're going to take you down this path or that, or we're going to change your medication, or we're going to do, these people don't stand up to you and say, I'm getting ready to take a gun and blow my head off. No. That's not how it works.
They just do it.
It just does not work that way. And so the families around them are stunned, as we were stunned. And I have to tell you, the country's got to wake up to how we are going about trying to figure out how to deal with suicide in the country. Because these are people who have decided, compellingly decided, that it's not worth living anymore. My life is not worth, I'm done today with life. Today, right now, I'm finished. That's where they go. And, they're not gonna say, I'm not going to call you on the phone, Ed, or me on the phone and say, hey, Jim, listen, I want to talk about this. It just doesn't work that way.
Well, thank you, Jim, for sharing that tragedy you dealt with your son. It's very, very sad, I think. And I can't imagine as a parent, it would be unbelievably horrible nightmare to lose a child. On top of that, it'd be their decision. And so, sorry for that. And I think you raise a good point from the standpoint of suicide. It's people don't really see it coming, and if they do see it coming, and it's lingering and lingering and lingering, those are maybe the people that are calling the hotline, and maybe those are the ones that get into the program because they're fighting it and they don't want to do it, and they're screaming for help, kind of like the Ben Richards story, And I think earlier you were referring to Simon LeMay. Simon's story, that these thoughts are going through their minds, but they're fighting it. They just continue to fight it. And Jim, if there was a miracle that you could tell me about, that if there was one miracle that you would just like to have happen, and you could share that with us right now, that God would give you and grant you that miracle, what would that be?
Well, for me, it would be that we would have a president of the United States that looked up and said, we're going to do this because it works.
Mm-hmm.
We're going to do oxygen therapy we're going to make it available for everybody who wants it and needs it because it works.
Okay. So would it be okay if you pray with me?
Oh, please do.
Say a prayer.
Thank you.
All right. So let's pray for that. Heavenly Father, please guide my president to make a difference in the application of hyperbaric oxygen so that it can be applied to all of the brain-injured people that he can impact, beginning with our military heroes that have been injured in war. And recognize the value of hyperbaric oxygen as it relates to the mental and brain health of all Americans. Please grant us this in Jesus' name. Amen.
Amen. Thank you.
Thank you, Jim. Appreciate you coming by.
Oh, very good to be with you as always, my friend.
Thank you.